autism is a neurodevelopmental disorder which occurs in children who are less than of 3 years. In this, the children will be having two deficits. One is the child will be having deficits in social communication and interaction, and other one is the child will be having repetitive restrictive patterns of behavior. So let's see the prevalence of autism. 1 in every 1,000 children will be affected with autism. So let's see who are those children who are having at risk for developing autism. So if any child who has not smiled or who has not showed any facial expression that is 6 months of age, or any child at the completion of 1 year who does not know how to talk or does not know to babble, those kids who does not know how to show for its needs, does not know how to show, does not able to reach for the objects what it needs, or those kids who are not responding to their name calls, these are the kids at risk for developing autism. And again, those kids who are not able to speak even after completion of their 2 years of age, these are the at risk population for developing autism. I told you about autism, prevalence of it, and the at-risk population. Why should we be aware of autism? This is because early identification helps in early treatment and early training of these at-risk kids so that the prognosis can be made in a better way. I told prognosis can be made in a better way. So how to identify? How parents can identify these kids? How teachers can identify these kids? So I told already there are two deficits. One is like social communication deficit, other one is the child will have repetitive restrictive patterns of behavior. So coming to first one, social communication deficits. Here the kids will have deficits in socio-emotional reciprocity, meaning that they won't be able to initiate conversation, they won't be able to respond to conversation, they won't be able to maintain this back and forth conversation. There will be deficits of non-verbal communication, meaning they lack facial expression, they won't maintain eye contact, they won't understand the gestures made by the parents, they won't be able to understand body language of the parents. And the other deficit is the child will be having deficits in making friends, like meaning that the child lack interest in making friends, they won't interact with the peers, sometimes they won't express their interest with the other kids. So this is the first one. The second one is that these kids will be having repetitive patterns of behavior. What do I mean by this? These autistic kids will be having repeated stereotyped motor movements. Example, repetitive clapping, repetitive like stamping the foot, repetitive head nodding or head shaking, like repetitive shrugging of shoulders like this, like repetitive movements they will do which does not have any meaning. Sometimes these kids will be having hyporeactivity or hyperreactivity to sensory stimulus, meaning like some kids will be very fascinated about the lights or movements. Some kids want to smell the objects repetitively, some kids want to touch the objects repetitively. Some kids will be like is autism. In autism, the one of the important characteristic is they want insistence, they want like persistence or insistence on sameness, like the whole day, like throughout the day they want fixated schedule, like every day they want to eat the same food, every day they want to take bath at the same time, like every day they want to go to sleep at the same time. If any minor change also, the kid will be very distressful and throw tantrums easily. These are the characteristics through which we can identify the autistic kid. I told early identification helps in treatment. So once we identify the kid, we doctors are there to treat the child also along with the psychologist. How do we treat? We have variety of options for treating these autistic kids. First we screen the kid. Like screening means, first I have told you at-risk population is there. Those kids we will be taking up and using our instruments we screen whether this child is going to become autistic. Once we screen, if the child is having at-risk for developing autism, we will treat them. We have two options of treatment. One is non-pharmacological option, other one is pharmacological option. Non-pharmacological method is the backbone of treating autistic kids. In this, like autism is one such disorder in which there are variety of programs which have come up on, like we can choose any one program and implement in particular child and help the child in training. We use behavioral techniques by using reinforcements and rewards through which we can train this kids, like this stereotyped repetitive movements can be reduced. And the other one is pharmacological methods. In this we use medicines, like this is because using medications we can reduce the irritability and repetitive behavior what the child does. Overall, using pharmacological methods and non-pharmacological methods, this communication can be made better and this repetitive behaviors can be reduced. This is how we treat these autistic kids. What I want to tell at the end is, like I told you about what are the characteristics of these autistic kids. Let's be keen in observing every child. If at all, if you feel this kid is more likely to develop autism, we can take these kids to the doctors, and early identification, early treatment better the prognosis. Thank you.